Hi, okay, here's a short presentation on menopause and heart health. So let's get cracking. So, oh, joy, there is an increased risk of heart disease when we are going through the menopause. Exact reason for this is not specific, but there are quite a few scientific studies that have been taking place. It's likely to have a combination of factors. For example, we're reducing our estrogen levels, and that is got a cardiovascular protective effect. So we're at more risk of cardiovascular disease because we have less estrogen looking after our heart. Menopause also induces changes in triglyceride and cholesterol levels, which can also potentially impact the risk. So we have got higher low density lipoproteins, higher density lipoproteins go down, and then it just makes a difference in the levels, which are not so good for us. And also, finally, quite a few people decrease activity as they go through menopause for many reasons, some of which are completely out of our control. Okay, here is an interesting study of physical activity and visceral fat, so around our abdominals. So this study has got a group of women who were meeting the recommendations of general health of 150 minutes of moderate intensity activity, and comparing them with women who are less active. So you could see that the less women, here we go. So in blue, we have got the pre and perimenopause. In the green, we have got the postmenopause. So we've got the total in the first column. The second column, we have got those who complete no significant physical activity, so are not very active. In the blue, you've got your perimenopause. Green, you've got your postmenopause. So you can see a big difference in the visceral fat there. And again, there's a change. And those who take part in physical activity, there is still a change between the perimenopause and the postmenopause of the visceral fat. However, the difference is not as much. As you can see, there's a greater difference between the physical and the non-physical activity. So regardless of menopausal status, premenopausal, the abdominal fat is around the same. And then if you have a look at the abdominal fat after menopause, those who did not carry on any physical activity, their abdominal fat is greater than the group that were physical activity. So the story is the more physically active you are, the less abdominal fat you are likely to have if you are active. Now, remember, these are only 150 minutes of moderate intensity activity. It's not 75 minutes of vigorous, it's at 150 minutes of moderate intensity, that intensity where you can feel your body working, but it is not running. It is basically going for a power walk. You feel your heart raising, you feel a little bit out of breath, but not really out of breath. So that's quite an interesting study. So for your heart health, it's recommended for 150 minutes of moderate intensity a week or 75 minutes of vigorous exercise. But now there's a lot of research coming out that the cumulative time is just as good. So if you had a cumulative hour per week, you can reduce your heart attack and stroke risk by 70%, which is huge, which is really huge. And that is of moderate exercise. So little tips: do what you enjoy, it's more likely what you're going to stick to, and identify opportunities for movements outside of your gym session to reduce stress and increase physical activity. Okay, so it's not just about the gym sessions, I just touched on that a moment ago. So if you spend an hour a day exercising 6 days a week, that's less than 6% of your waking hours a week. We need to have our heart working more than that. So we want to move more and feel empowered to look after our own health. So postmenopausal women seem to spend less time exercising at moderate intensity than premenopausal women. Could be for lots of reasons. It could be change of job. It could be they had a family and the family have left home, so they're not having to run around after them. Maybe their job has changed. Maybe they had an active job and now they're desk bound. Maybe there's less demands on their time. Maybe their lifestyle has changed. Maybe their health has changed. So as a postmenopausal woman, you do need to be more and more aware of movement throughout your day to increase your movement. So some stats. Okay, so this one's great. The researchers pulled results, this is from the British Heart Foundation, from 13 studies, and found that people who exercise for more than 4 hours a week, this is moderate exercise again, had 19% lower risk of high blood pressure compared to those who spent less than 1 hour a week exercising. So if you are raising your heart rate, you are working hard for 4 hours a week, you are going to be, you should be lowering your risk of high blood pressure. And then secondly, this is great. Adults who lifted weights for 1 to 3 times a week or a total of 1 hour could reduce their risk of heart attack by up to 70%, particularly those with type 2 diabetes, which is brilliant. And this is also for strokes as well, heart attack and strokes. And then thirdly, researchers used a cohort of 13,000 adults and found that resistance training also led to reduced prevalence of cardiovascular disease, morbidity, and all causes of mortality. So we can't really argue with it. Sometimes we just need to be reminded of the impact of exercise and how it can help. Okay, if you have got questions about menopause, heart health, this is a really quick stopgap, but please do email me, kirsty@infinitebalance.co.uk, and we can go from there. Bye.